can you actually change a lumbar lordosis? And the reality is, yes, you probably can if you know how. Now, some of our patients will be suffering from facet joint strain, spondies, compressive loads down the posterior elements in here as well, with a sway back. If you have patients like that, there is a way that you can actually reduce that sway, going from 65 in the lordosis to 57. Now, there's a sophisticated array of technologies and surgical interventions that can do this as well, but not with the degree of safety that's being used here, nor the quick, empowering ways in which a patient can do this to themselves. So from the 25th of May to the 25th of June is 1 month, and that's an 8-degree drop, roughly 2 degrees a week. We continued on from the 25th of June to the 21st of July, again a 9-degree drop, and again another 2 degrees per week. So this person here is experiencing profound health improvements. So as we said, it's possible to reduce the lumbar lordosis from 65, 57 to 48. This is a 2-month program, and again we've got 1 more month in the program to completely change this lumbar lordosis, which has been crippling the gentleman for 3 years. Incidentally, what happened was his P to A, that's looking from behind to the front, scoliosis changed. And there's no doubt that there is a link between the sagittal curve and the coronal curve or coronal plane. Here it is in the thoracic section. Again, here it is in the lumbar section as well. So if that was an example there of one person, here's another of a person using the same technique, but also this time affecting their thoracic kyphosis, hunch, Scheuermann's in this region. It's going from 84 to 75 in 1 month. And again, in another gentleman here who started at 110. Now, this gentleman has actually paved the way for many others because he's been with me for 4 years. He's dropped 30 degrees. He's gone from 110 down to 80 degrees. But what we're doing in years now, we're actually achieving in weeks and months here in these 2 new clients in the clinic. So it's a very exciting development to give people ways that are non-surgical. And if you just take a look at the degree of sophistication which I alluded to, here it is here. There is a massive amount of technology that is available using CT scan, guided surgical procedures, the incredible degree of sophistication that has been developing over years, but it's unfortunately too complex, prone to revision surgery, sometimes in 75% of cases, if the angles are out of balance with the sacral harmony. So the lordosis and the pelvic sacral slope are not in alignment. It's very easy for more surgical procedures to unfold. Contrast that with these techniques which don't involve surgery, and this is a very big improvement towards healthcare transformation for people with appearance disorders. So my name's Daniel Dahdah. Please take a look down in the description box if you'd like to make contact. Leave a comment in the comments section below, and let's see if we can help you transform your patients' lives as well. Thank you for watching.